Thanks for coming to the Alumni Club Health Insurance Seminar. I don't know how many years we've been doing this, John. A few? Six years or so, and we've discovered that there's a real need, and everybody is interested in hearing about information. This year, for whatever reason, we're actually down in the number of people that have registered, and I hope that that's a good sign that in previous years, last year we had nearly 1,000 attend this seminar. This year, not so many, around 200. That we've encouraged people to actually get a connection with insurance advisors and figure out what are the best insurance policies you could possibly have. So that was an encouragement that we also made, that people set up, if they have a relationship with an insurance agent, they might actually gain as much or more information by having that appointment. I'd like to have give a special thanks to the Primetime Advisors. This is a relationship that the club has had with Primetime for more than the number of years that we've had seminars. And I actually specifically want to mention that John Whalen is going to be living in Florida a lot longer than he used to be. but John Whalen, Mike Salscheider, Mitch Culling, I'm sorry, Pat, thank you very much for all the work that you've done with putting the information together for today's seminar. Over the past years, Primetime has saved IBM retirees a lot in spending on insurance, and I can personally attest to that now that my wife is on Medicare, how much help that they've given. I hope that this seminar will help you with your decisions on the insurance needs that you have this coming year. I'd also like to thank the Alumni Club members that helped coordinate this event. Dave Natz, who's standing in the corner, was the head of the committee. Dave, we have a few other board members that were sitting at the check-in table. If you like the Alumni Club events, if you've taken advantage of them, I strongly encourage you to volunteer for an event, or even better yet, volunteer to be on the board. That's my paid political announcement. I also would like to thank Redeemer Lutheran Church. They have allowed us to use this fellowship hall for free, and so really appreciate that fact. This seminar is free for you to attend. If you feel you've gained some advice from this seminar, we have some donation baskets on both exits, and I'd appreciate if you'd be willing to donate a small cash donation. Anything that we do collect will actually go to the church to compensate them for allowing us to use this hall. Some final disclaimers here, and then I'm going to get it over to our presenters. This is not an IBM event, nor is it a one exchange. These seminars are being hosted by the Alumni Club. It's an informational seminar to help our club members. Please understand, any decision that you make on health insurance is your decision and your decision alone. Again, this seminar is being videoed, so I appreciate minimal movement amongst the people here. And finally, I think I'm going to actually hand this over to Mr. Whalen, who is going to take us through the first part of the presentation. Thank you.
Please remain seated. He said that already. We found out that we could not connect this thing unless we were wearing a big turtleneck, and so we're holding it. You notice Roger was holding it too. Can everyone hear me okay?
Yep.
Okay, well, I'll tell you what, I've got to admit I've got some mixed emotions here because I'm looking at several familiar faces that I've been working with, and you're probably aware of the definition of mixed emotions. That's your mother-in-law driving your brand new Cadillac off a cliff. But my mother-in-law is 103 years old, and you may have seen her on the news. Did anyone see something on the, no one watches KTTC news. You need to report it. Did you, Mike saw it, okay. They just had a party for her at Gramercy Co-op. Does anyone in the room live there? Okay. But she's living there, no assisted living, cooks her own meals. It's just absolutely amazing, 103 years old. And the best thing she ever did for me was give birth to my wife, who, and it's worth the look, she's standing in the back there at the doors. That's my wife, Marilyn, and today is our anniversary. So when we got married, we had no idea that our anniversary would be on the first day of the Medicare renewal every year. So we celebrated a few days ago because there's no time now. And for those of you who got the letter, this is the last thing I'm going to say personal. For those of you who got the letter,
what letter?
the renewal letter with the beautiful pictures of Mitch and I on there. We missed one sentence in the letter, and that is that Marilyn and I will be retaining our Southwest Rochester townhome 1 block from the primetime offices, and we'll be in Rochester 5 months a year. Now it did say in the letter that I'm on an on-call, and I was even so daring as to give you my personal cell phone number and personal email address, so I will operate as a backup. You're going to be meeting every primetime advisor except I think Pat's not going to be speaking. So Pat, would you like to, we'll allow you to stand up and just wave. This is Pat Downs. She has a long, long history in Medicare and non-Medicare. By the way, any of you who are not in Medicare yet, we are going to be covering that too. So you could maybe advance. There's just our listing. That's on your sheets, and I think that one's readable. Some of the slides in there, we're going to recommend that you take home and get out your magnifying reading glass, and you can see what's going on there. So, our ground rules for our seminar today are that we're going to be covering Minnesota material. Everything is different in every state. That's the way that the federal government set this up. And you may have heard politicians talk about, I wish we could sell insurance across state lines. That has not happened yet. There is still state regulation on these plans and federal. So this presentation is geared to Minnesota. It covers Medicare eligible IBM retiree choices for health insurance coverage. Typically, you're interacting with one exchange. We're going to have some ideas for you on how to make that process move smoother and how we can help you in that process if you haven't already worked with us. But we're also going to look at the non-Medicare marketplace because there's a lot going on. How many have heard about the massive rate increases with Blue Cross? Okay. We have had so many phone calls on that, and mostly from Medicare clients. It does not affect you if you're on Medicare. These horrible stories that you've been reading in the paper and hearing on the radio and television. But it does affect you if you're not on Medicare. And we're going to be talking about that just within the next minute. We're going to cover that first in the seminar, and then we're going to go into the remainder of the bulk of the seminar on Medicare issues. Our goal is to help you find the most cost-effective plan. If you're Medicare eligible, by interfacing with one exchange. If you're not Medicare eligible, and we know we have a lot of, we call them mixed marriages. Okay? Where one spouse is, well, Roger Speed is an example of that. One spouse is Medicare eligible, one isn't. Okay? And we know how to help you with that. And we provide personal face-to-face service there is no cost whatsoever for the service we provide. We're going to cover that again towards the end, but we are compensated by the insurance company that you select after we go over all the options with you. We don't carry water for any insurance company. Blue Cross is doing a big job right now in Medicare that looks very attractive. Mitch had a huge paper cut this morning as we were getting ready for this, and he did not bleed blue. He bled red. But we're wearing as much blue as we can because this is an IBM seminar. And so I have my primetime sweater, but I got too hot, so I needed to take that off. So, as I said, we're going to start with the non-Medicare. And Mitch Anderson, new kid on the block, not that new really. He started in an internship with us almost 3 years ago, went full-time with us a little over a year ago, and he is MNsure certified. The rest of us got really frustrated with that and let it go. So he's our guy, and I'm bringing Mitch up now to talk about the non-Medicare aspects.
Thank you, John. I'm going to speak very briefly this morning on non-Medicare MNsure marketplace. Sorry about this slide. It's very difficult to read, but I'll touch on some of the highlights. Some of you have a future health account, and you're looking for ways that you can maximize or prolong your benefits. And one way, or one thought, is to utilize the MNsure marketplace with a premium tax credit subsidized individual health policy. This can be possible. I have the column that's the most effective column is on the far right-hand side. And if you can show your modified adjusted gross income, which is line number 37 on your 1040 IRS form, if you can show that as a value of equal or below the number on the far right-hand side, and just as an example, household of 2 people, that number is $63,720. You may qualify for a subsidized premium on the individual market. The next several slides that we put together show some examples of what the pre-subsidized premiums would be for the marketplace. I listed 3 different plans. There's 2 from Medica and 1 from Blue Cross. And the reason why we did that is these are the most effective plans in our market. There's a Medica plan that includes Mayo Clinic as a network provider. There's a Medica plan called the Applause plan that includes Olmsted Medical Center as a network provider, and then a Blue Cross plan that includes both Olmsted and Mayo as a network provider. So the numbers that are reflected here, the monthly premiums, once again pre-subsidy, are the first slide is for someone age 55. The second slide is for someone age 60. And the third slide is for someone age 64. All of the bands, all the pricing premiums are rated by age. So I just put a snapshot up there of some prime examples of where folks might fall in on a subsidized, perhaps subsidized premium basis. The next slide, which is a reflection of the premiums that will be available to you through your IBM plan. We don't know what those rates are yet. They're yet undetermined. I believe generally they come out in the beginning of November or the end of October, so they should be coming fairly soon. I encourage folks, once you get those premiums, if you have questions on how to work through the potential MNsure process and subsidized premiums, any questions, please let me know. It's a big, ugly monster, but I can help you. I can help you with it. I can help you navigate through it. So the remainder of the presentation is going to focus back on the Medicare market. So make sure and see me if you have any questions. Thank you.
Thank you, Mitch. I'm not sure how many, I'm not going to ask for a show of hands, I'm not sure how many we have in the room. that are not on Medicare, or possibly have a spouse who's not on Medicare, but you get a sense of the dramatic cost differential. The worst place to be right now for health insurance is from age 50 to 64. Because the insurance companies have identified that's where people are starting to break down a little bit and have expensive health issues, and you don't have that sheltering of Medicare. So in meeting with the Alumni Club, we wanted to really make it clear that we can help in that arena. We didn't want to make this strictly about Medicare. Those of you on Medicare, when you look at those numbers, would you flip back just to one, to the age 64, if you would. Oops, go the other way. And I realize this is incredibly small on your sheet, but as I say, when you go home, if you've got one of those magnifying glasses, you can take a look at that. But at age 64, for a $6,300 deductible, the best premium for someone making more than the amount, as Mitch was indicating, more than for a two-person household, $63,000. The best monthly premium is, everyone's sitting down, so don't fall off your chair, $646 per month. And the deductible per person, and the deductible is $6,300. Means you don't get any help until you've blown through that deductible. Now compare that to what you're doing in Medicare right now. Aren't you glad you're on Medicare?
Yes.
We love working with Medicare. People are happy. Okay. So, all right, if you could advance a couple. I don't know how to run this thing. Mitch is our, Marilyn works with us in the office. My wife, she calls Mitch the help desk. He's 42 years old, you know. Okay, so, yeah, there you go. All right, we're back to Medicare now. And the funding and reimbursement. This is right out of the OneExchange / IBM materials. And it talks about if you currently receive a premium subsidy from IBM, you'll continue to receive the contribution in the form of a health reimbursement arrangement. So you're familiar with that. Most of you hopefully have a handle on how much you get each year, and you know that you have to file for reimbursement. The paragraph that we really want to draw your attention to is the very last paragraph on this page. Many of you are aware of this, but if you're not, we just want to reiterate this. To receive your health reimbursement amount annually, you must enroll in a medical or prescription drug plan through OneExchange. And then there's even an exception to that. There's a veterans exception. It's possible to actually not be in any plan where OneExchange is your agent if you have veterans benefits that you can document in OneExchange. That's something we want to go over with you on a case-by-case basis. The import of this paragraph is enormous because it doesn't make it entirely clear here, but this has been field tested and we know this only applies to the IBM retiree. Okay? It does not apply to the wife or husband, the non-employee, at all. So the bottom line is, and we'll go to the next slide, this reiterates it again. This is an email that was sent back to one of our clients who got frustrated in dealing with OneExchange. That hardly ever happens. Has that ever happened to anyone? Okay. But he got really frustrated, and he'd been working with us for years before the whole changeover with IBM. And he sent an email to Dr. Ree. Did anyone meet Dr. Ree at the event center when this was first rolled out 2 years ago? And he said, you know, I used to have local representation. I understood it. They were helping me face to face. Can I get away from this thing, or what's the minimum that I have to do? And this is crystal clear what the minimum is that he has to do. I won't read the whole thing, but it's right there in front of you. And what it amounts to is that you as an IBM retiree need to do one plan with one exchange. Either a medical plan or a direct plan. You can also do dental plans, vision plans. They don't count. It has to be a direct plan or a medical plan. And at your option, we can help you with all the rest of it. So I just wanted to make that clear to you. Many of you in the room know we are filing your reimbursement forms for you. We're putting them in front of you, having you sign them. We're providing the documentation that you paid your premiums because we receive that information from our insurance companies, and we're handling that whole process for you. So we are available to do that. End of advertisement. Okay, so now we're going to delve into the actual details of all of the various general categories of Medicare plans. And that's why we talked about the Medicare and You book. Maybe some of you brought the Medicare and You book. You'll have a bigger slide if you did. And so we're going to bring up now Colleen Van Epps, who's been with us several years, and she's going to talk about Medicare Advantage plans and Medicare supplements.
Okay, can everyone hear me all right? Yes. Hello, everyone. I'm Colleen Van Epps. I've been working with Prime Time for a little over 3 years. And Mike has been my manager with Blue Cross Blue Shield for about 13. So anyway, when you go on Medicare, basically in the state of Minnesota, you have 3 options of health plans that you can choose from. The first one is the Medicare Advantage plans. Typically, the Medicare Advantage plans, you may have heard of UCare for seniors. You may have heard of Humana. How many have heard of those? Okay, so those are examples of Medicare Advantage plans. And the advantages of the Medicare Advantage plans is they tend to have lower premiums. You have one ID card, because with the Medicare Advantage plans, you can have your medical and your drug plan together. So they call it an all-in-one plan. And the claims are processed through that company, like UCare or Humana, and then they work behind the scenes with Medicare. You still have your Medicare benefits with those plans, but they are done in a different way. So all the claims and the processing go to the company first. And so yes, you have all-in-one, and a lot of people like that. Those are some of the advantages. Some of the disadvantages are, when you want to make changes to the plan, that's when you hear about those enrollment periods from October 15th through December 7th. When you hear about that, that's the time that you can make changes, and then they'll start in January. So you could get into a situation where you have a lot of co-pays going out, and one of the things I think of with having extra co-pays is like when you have to go to maybe physical therapy 3 days a week and paying $15, $20 a co-pay, which can get expensive. But typically you're in those plans for that year. But you can make changes 2 times during the year. One is the disenrollment period, and that starts from January 1st to February 14th.
Valentine's Day.
Yeah, Valentine's Day, there you go. So you can make changes and come out of those plans, get a special enrollment, pick up a drug plan, and go into getting maybe a cost plan or Medicare supplement. So, and the disadvantages with those plans is that they might limit your provider network. So, and recently we've seen government cuts to those programs. So that's some of the disadvantages. And when we meet with you, we can go through all that with you. The other plans that we have are the Medicare supplements. Thank you. And the Medicare supplements are typically called Medigap plans. You might have heard of like that. The examples of those are the United Health AARP, and you've heard of Blue Cross Senior Gold. So those are two Medicare supplement plans. Now, the advantages of these is that they're guaranteed renewable. Each year, you're not gonna have to wonder, is the government going to drop them or change them somehow? They're portable. If you move out of the state of Minnesota, you can take them with you. And they have very comprehensive coverage. So I like to call them the creme de la creme of plans. They don't have a lot of bells and whistles, but they do cover what Medicare, if Medicare deems it's necessary, and if Medicare covers, the plan truly supplements it on both Medicare A and B. So they have continual open enrollment as well. So you could be in a cost plan and go to a Medicare Advantage plan, but if you do that, you need to, if it's beyond your 6 months that you just started Medicare, you'd have to do a health history. And that's one of the disadvantages, is that there are underwriting if you've gone beyond your first 6 months of joining Medicare. Now, they have lesser preventative, and what we mean by that is, like in some of the cost plans, how many here have cost plans? Well, you know that they have a vision package. They have, you get your eyewear up to $125 on most of those plans, and $450 toward hearing aids. These do not have those. And so that's a little different there, and we can go through all that with you. They don't have a fitness program. A lot of you have Silver and Fit, and you have the fitness program where you can go to the Y and things like that. So that's some of the disadvantages. Medigap plans are also referred, like we said, as Medicare supplements. And they're offered by private insurance companies, and they truly fill in all the gaps that Medicare doesn't do. If it's, this is your new thing, if it's, you go to the doctor, if it's medically necessary. So prescription drug plans, they are added on to these plans. They're not embedded in them like some of the Medicare Advantage plans or even the cost plans. So you would have to add that on. There are some Medicare Advantage plans that you can put a drug plan with, and those are the private fee-for-service plans. And then the Medicare cost plans are available, and Mike is going to be coming up and talking about that. But in most cases, when a person enrolls in a Medicare supplemental insurance, they will choose between the following two options that you can see here on the bottom. They're either going to get a Medigap plan or a Medicare supplement and attach it to a Part D drug plan, or they're going to get a Medicare Advantage plan, which a lot of veterans get Medicare Advantage plans if they don't need a drug plan, but we'll go into all that later. So that's basically it. And Mike, I turn it over to you.
All right.
Should I just leave this here?
Thank you.
All right.
Okay, folks,
Oh, microphone way up there.
up here,
Yeah, way up there.
wish I didn't have to use this. First of all, I want to just clarify something for those of you that were wondering about John's letter. John and Mitch's letter only went out to their clients. And if you don't know what's going on, John is tired of paying state income tax. So he's moving to Florida permanently January 1st. So he'll establish Florida residency, John and Marilyn. And then they will come back in the summer though and get out of that heat and sweltering humidity of Florida. And so John and I have been associated together for quite a long time. I'm very disappointed to see him go. But we built, I think, a wonderful operation. We saw a niche many, many years ago to help people turning 65 with their Medicare choices.
Can everybody hear him? Need that
It's
microphone?
really
Sorry.
difficult, especially with the advent of advantage plans and drug plans. People are coming into our office and saying, help, this is overwhelming. They were getting all this literature, all this mail, and they were befuddled. So we thought, boy, we could really help these people out. So we made that our concentration was on Medicare planning. Okay, speaking of Medicare, we're going to talk about cost plans. Now, these are very unique plans, unique almost to the state of Minnesota. If somebody's watching this video and they reside in some other state, this is probably not going to be a plan that you're going to be available, that'll be available to you. Although they do have cost plans in North Dakota and South Dakota. And those probably are, they're through Medica, so they're very good cost plans too. The two companies that we use primarily are Blue Cross and Medica, and primarily Blue Cross, strictly because, or only because, the cost is more advantageous with Blue Cross. Medica's got an excellent cost plan as well, but the premiums are a little higher, so our philosophy is go with the lowest cost plan if the benefits are the same, and they basically are. So there's a broad range of plan options. One of the neat things about cost plans is that you can switch plans on the first of any month. So if somebody's in a lower cost plan and you have been diagnosed with, this just happened recently to my sister who lives in Eagan, Minnesota. She was diagnosed with rheumatoid arthritis. She was on the Blue Cross Choice Plan, $74 a month. As soon as she told me she was diagnosed, then she said, yes, I have to go in for some infusion therapy for a drug called Orencia. And I said, well, that's a Part B drug, that's going to be covered on your current plan at 80%, but if we upgrade you to the complete plan, it'll be covered at 100%. So I filled out the form, and the first of next month, she went to the complete plan, and now all of her treatment is covered at 100%. So that's one of the nice things about cost plans. You can switch, actually on a monthly basis, you can go down too. You're in a complete plan and whatever. I had a total need done a couple of years ago, and I switched from the choice to the complete, had my surgery, all my physical therapy, my office visits, then a couple months later I switched back down to the choice plan. So there is a lot of flexibility on cost plans. Attractive, generous travel coverage. You can leave the state of Minnesota for up to 9 months and be covered just like you were in Minnesota. So it's a beautiful plan for snowbirds. You can go to any doctor that accepts Medicare, so you're not tied into a restrictive network like some plans are. Any doctor that accepts Medicare, you're good to go. The cost plans also offer fitness benefits, Silver Fit, which gives people in Rochester free membership to a couple choices of health clubs, the Family Y in Northgate. Snap Fitness, I just found out, is also an option now too. Or you can get a home exercise kit if you don't want to go to a health club. There's vision and hearing benefits. So people ask, should I have a vision plan through IBM, through One Exchange? Our take on it is, well, you already have a vision benefit if you have a cost plan. Because you get your exam every year at no cost, and there's allowance for eyewear. I know it's not much, $125 for a pair of eyeglasses, but it's better than zero. And it's built into the plan. There is also a benefit for hearing aids, $450 a year. I know that's a drop in the bucket if somebody's getting a new set of hearing aids, but it'll help out. You can also use that $450 for hearing aid repairs. So you might be able to utilize that. Down at the bottom it says 75% of cost plan enrollees live in Minnesota, and that's unbelievable. The cost plans were established by the bill that created the drug plans. There was just a little section in there that said the federal government will work with private insurance companies. That the catch though is they had to be nonprofit insurance companies. So that left out United Health, which is headquartered in Minneapolis, the largest health plan in the United States, insurance company in the United States, Aetna, Humana, some of those companies, because they are for-profit. So for some reason, the state of Minnesota jumped on this. We have what we call the big three: Blue Cross, Medica, and Health Partners. They're all nonprofits. So they jumped on this bandwagon. And I'm just so excited that we have these plans available to us because the benefits are wonderful. The government participates in the expense of these plans, which makes it very reasonable for us that have these plans. The disadvantage, though, is that all 75% of all cost plans are in the state of Minnesota. So what's going on, you know, all the people in Congress get together and look at the expenses. They say, why are we spending all this money to benefit the residents of just one state in the United States? That's not fair to the 49 other states. So they have been trying to do away with cost plans for several years. President Obama just signed a bill this spring to extend the deadline January 1st, 2019. We have up here 12/31/2018, which will be the end of most cost plans as we know them. Now it's a very complex law, and there are exceptions to that. I understand that cost plans will continue in North Dakota and South Dakota after that date, and maybe in some counties of Minnesota. We don't know yet. But for all intent and purposes, cost plans will disappear January 1st, 2019. The good news, though, is that when they disappear, it will trigger a special open enrollment period for all of us who are in cost plans. I say us because I'm in cost plan myself. And that means that you can go out and purchase any plan available in the state of Minnesota, including Medicare supplements, with no health questions asked. So you won't be left out in the cold. You'll have a lot of choices. We've heard from Blue Cross and Medica that they are working furiously right now to have a plan available in 2019 for those people who are in cost plans today. We'll just have to cross that bridge when we get to it. But I guess our take on it is, we have these for 3 more years, 2016, 2017, and 2018. Why not take advantage of them while we have them? I guess I want to say another thing about cost plans and why it's beneficial to work with us. I said these are unique to the state of Minnesota. When the One Exchange started their program 2 years ago, it became very obvious to us that a lot of these One Exchange advisors were not familiar with Minnesota cost plans. In fact, they were trying to convince most people who were calling in that they needed to go to a Medicare supplement, which is the plan of choice in 49 other states. Primarily the ARP Medicare supplement, which was running about $200 a month. And it's very comparable to the Senior Gold, which is Blue Cross Platinum Blue Complete, which is $109 a month. So considerably less cost, and the coverage is almost identical for doctor and hospital. There is a section on cost plans, Blue Cross cost plans, where Part B drugs, Medicare Part B drugs, are covered at 80%. Like I said, my sister had to go in for this infusion therapy. If it's infusion therapy, it's administered in a clinic, it's covered at 100% on the complete plan. These are nuances that we know at Prime Time Health, but the advisors at One Exchange were clueless about. We heard horror stories. I mean, we heard feedback that One Exchange told some people, well, you can't have that plan and travel outside Minnesota. And yet it's got a 9-month travel benefit. And we heard one person said, well, they told me I can't go to the clinic with this plan. That's not true either. So I guess the point I'm trying to make, we already talked about, you have to have one plan with One Exchange. We suggest You work with One Exchange on your drug plan, work with us on the cost plan, because we know the plans. It said 80% coverage on Part B drugs. Medica next year has a cost plan that covers Part B drugs at 100%. It's more expensive, but if you're diagnosed with something where you're gonna give yourself injections of a Part B medicine next year, you can go into that plan the first of any month. And we can help you do it. I don't know if One Exchange would be able to do that. That they're knowledgeable about that. Okay, enough of that. So cost plans, I guess, are where it's at in the state of Minnesota. It's the plan of choice for, I'd say, the bulk of the people. Next slide, please. Oh, boy. All right. You know, the premiums on Platinum Blue stayed the same next year. They're staying, or cost plans, staying the same. Medica had a few changes, but not big changes. The drug plans, though, holy smokes, every year, at the end of an open enrollment, open election period, we say, it can't be this bad next year. And every year it is, because these drug plans keep changing. Well, I guess I kind of understand what's going on. I just sent out a letter to my clients recently, and there was an article in there about the huge increase in the price of generic drugs in the United States. I don't know what's going on with these drug manufacturers, but there's a huge increase, inflation spiral in these generic drug prices. Well, the drug plan companies have to pay for that, because you're just paying a copay. Sometimes you're getting them for free. So I guess it's obvious that these drug plans have to make changes. They have to increase premiums, increase co-pays. The deductible for next year is automatically going up. The federal government sets the guidelines. So this year it's $320, next year it's $360. So if you have a cost plan, the suggestion is you have a standalone drug plan. So let's, Mitch, your Medicare and You book, you have in the back of your Medicare and You book, you have pages that outline all the drug plans available to Minnesota residents for 2016. And you can go through these. We've already done the work for you. So even though we say you should get your drug plan through One Exchange, we're very available to offer a second opinion on which drug plan you might be thinking about. Now, a lot of people are in the Blue Cross Value Plus plan. Well, that's disappearing next year. Blue Cross is combining two plans into one, so the Value Plus will be called the standard plan next year. As you can see on the slide, it'll be $35.10 a month. It will have a $360 deductible, however. This year, the Value Plus plan with Blue Cross has a $160 deductible. So they're raising the deductible $200. So, boy, this drug plan situation is almost on a per person basis. You can't just make a general statement saying you should be in this plan. It depends on what medicines you're taking. There are some instances you say, well, $360 deductible, that's not a good plan. Well, it depends on your medicine. If somebody's on an expensive inhaler, for example, like Advair, $360, you're done with it in January. Your deductible for the year is done. And then the copay is very reasonable, especially if you're using one of the preferred pharmacies, and they're all over Rochester. Hy-Vee, Walmart, Target is new. Not Walgreens, there's another one I can't remember. The Medicine Shop, that's called Guide Point now. Hunt Silver Lake, those are all preferred pharmacies in Rochester. Sam's Club, Walmart Sam's. So that might still be a really good plan for certain individuals. If you're on insulin, if you're taking some expensive preferred brand drug, get that deductible out of the way early, and then you have really good co-pays for the rest of the year. Let's skip up forward an inch, please. We're affiliated with 4 plans for next year. We go through this list and we try to figure out which are gonna be the best plans, cover the most people, and we get affiliated with them. So we're pretty familiar with some of these plans. First Health Value Plus, that was a really good plan several years ago. It looks like it's gonna be a good plan next year, $22.60 a month, $72.60, 0 deductible, but the Value Plus is $32.40 a month, no deductible. So some of you that are working with One Exchange, you might want to talk about that plan. Humana is a big player in the standalone drug arena. One of the big plans is the Humana Walmart, $15.70 a month this year, going to $18.40 next year. Now, we, at this meeting last year, we said that if somebody's only on 1 or 2 generic drugs, a couple generic, low-cost generic drugs, or on no drugs, boy, this is the plan. It's the lowest cost plan in the state of Minnesota. There is no deductible for Tier 1 and Tier 2 generics. So you don't have to pay the $360 deductible. And you have very low co-pays. The catch is you have to use Walmart or Sam's. But they also have a mail order program. And if you use their mail order program, which a lot of people use, companies called Right Source out of Phoenix, your co-pay for generics is 0. You have free generics. So this might be a plan that some of you might want to really take a look at. Another new plan, or not a new plan, but another plan I think will come into play next year is the SilverScript plan. SilverScript Choice, it's $24 a month, but there's no deductible. And so if you're saying, I don't want to pay a $360 deductible, I just as soon pay 0 deductible and maybe a little more money, but $24 a month for a 0 deductible plan is a pretty good rate. Yes, the co-pays are higher, but then you're gonna have to balance it out, paying the higher co-pays but no deductible, or pay a deductible and low co-pays. You're gonna have to balance that out. For those of you that are pretty computer savvy, the government does have a wonderful webpage, Medicare.gov. And there's a drug finder on that webpage, and you can plug in your meds, the dosage, the pharmacy that you get these meds at, or mail order, and it'll show you the best plans and the lowest cost plans in Minnesota for your specific drug. That's what we do when some people bring in lists of meds to us. We go on that webpage. All the companies, by the way, have their own calculators. Blue Cross has one, Humana has one, SilverScript has one, United Health ARP has one. But I think next year, the big players are gonna be Humana and SilverScript, and I think the new standard plan with Blue Cross will still be a player. United Health, AARP is another company we're affiliated with. And $430 for the Sabre Plus. Let's back up one page.
$40.
Yeah, $40.30, so they have a 6170 plan with no deductible down at the bottom there. And they have preferred pharmacies, also in Rochester. It's not as extensive as Blue Cross, but they do have a pretty good range of preferred pharmacies. And if you use one of those pharmacies, you pay a lot lower copay. They have a mail order program with even lower copays. So, John was just telling me the other day, he ran one of his clients through the Medicare.gov calculator, and the lowest plan was this ARP, United Health ARP Medicare drug plan. So you just can't say generalize that if it's got a $360 deductible, it's not a good plan. It depends on the meds and the copay, and if you're willing to do mail order or use a preferred pharmacy. So we can give you a second opinion. I would encourage you to kind of analyze your drugs, check them out on the government webpage, and then if you come up with one that you really think is going to be best for next year, when you have your interview with One Exchange, that's the plan you should go with. If you just want to bounce it off of one of us for a second opinion, give us a holler. We'd be glad to help you in that regard. Any questions on drug plans?
Yeah, you mentioned drug source. Right?
Humana owns Right Source.
Yeah.
Yeah.
But they changed their name, I think.
Yeah, it's Humana Pharmacy.
Right Source
now.
is now.
Humana Pharmacy.
Yeah.
Can you repeat that in the mic so we get it recorded?
Yes, Right Source, which is the mail order company, is owned by Humana. Now they just changed the name to Humana. You know, they've always owned Right Source, as far as I know. Yeah, Humana Pharmacy. Okay, so constructing your total Medicare package.
Oh, Mike, you've got a question, I think.
Oh, okay.
So you're not limited by what, One Exchange is showing you for prescription drug plans?
No.
Okay. You can get anything from,
Well, you can suggest to One Exchange, the advisor, One Exchange, that you have done your homework and you want to go into this certain plan. But most of the plans we're talking about are available through One Exchange.
I do not see some of these that are in the Medicare book out there.
Mike, can I jump in there?
Sure.
What you're referring to is that we've identified that they have just 15 drug plans on their choice list, One Exchange. And there are, for 2016, there are 23 drug plans available in the state of Minnesota. So our view on that would be that if the right drug plan for you does not appear in there, you don't feel limited to that because it's not what we would prefer, but you could do your medical plan through One Exchange and you could do the drug plan outside of One Exchange. For the employee, again, the retiree. Again, the spouse does not have to buy any plan from One Exchange, none. Now, we do have several dual retirees. The husband and wife both worked at IBM. In that situation, then they each need to buy at least one plan. But you are absolutely correct. They don't have every plan, every drug plan on. They're missing 8 drug plans. I think what Mitch researched this, did you want to make a quick comment? Okay. He said mostly, though, that he didn't feel there was a whole lot missing. It would be rare for one of those 8 drug plans to be your best drug plan, but it certainly could happen.
And I know the ones we're talking about are options for you through One Exchange.
Okay, good.
Blue Cross, Humana, Silver Script, and United Health are on the choices through One Exchange.
I just wanted to say one other thing. If those of you that are on One Exchange, how many have made an account on One Exchange online? Raise your hand. If you have your drugs listed in there, which I think you should or you do, they can help you on there as well, just like Medicare.gov, if I'm not mistaken.
Okay, so, oh,
I was just gonna say that, we have the Walmart, plan, Humana Walmart.
Humana Walmart.
And they do recognize our local Snyder drugstore. You know, if you need a drug for like 2 weeks or something like that, the copay was like $5 for amoxicillin, for example. So
Okay.
they do run it through their account also. They allow it.
I'm sorry, just a clarification on that. The actual cost of amoxicillin is $5.
Okay.
You got no benefit on the plan.
Okay, yeah.
Okay.
yeah, the Humana Walmart plan doesn't say you have to use Humana or Walmart. You can go to any drugstore. But you're gonna pay a whole lot higher copay if you don't use Humana or Walmart or Sam's.
Mike.
Got a lot of people,
Go ahead.
yeah, right, who use Sam's because there's a drive-up window. If you like to talk to a personal pharmacist, you can use a drive-up window in back of Sam's for prescriptions only. You don't have to be a member of Sam's. and you can just drive around the building, pick up your drug, and you're on your way.
Please repeat questions, because we
Oh,
want to capture them in
okay.
the video.
If you are on Medicare, is it mandatory that you have an additional drug plan?
Okay, the question is, if you're on Medicare, eligible for Medicare, is it mandatory that you have a prescription drug plan? The answer is no. You do not have to have a drug plan. The problem, though, is if you don't have a drug plan, you're gonna be subject to a penalty. If the day comes when you say, hey, I was just diagnosed with diabetes, I'm gonna be on insulin, I better go get a drug plan. The penalty's 1% a month for every month you went without a drug plan, starting the effective date of your Medicare Part B coverage. So if you went 4 years, that's 48%, right? Well, the question is 48% of what? It's of the average drug plan cost in the United States. So let's just say it's $40. Well, roughly 48% of $40 is $20, let's say $19. So whatever drug plan you then purchase, you'd have to pay an additional $19 on top of that premium, and you'd have to pay that every month for the rest of your life. So generally, it's not advisable to go without a drug plan. I mean, you never know what's gonna happen either. You know, you can have a very serious infection, and all of a sudden, you have to take some expensive antibiotics. And if you don't have a drug plan, you're paying for those out of your pocket, you know. And the drug plans, you cannot take out during the middle of the year. You have to wait till the open election period. So all the drug plans wouldn't start till the following January 1st. Yes, sir?
I just wanted to mention, unless it's happened in the last couple of days, a lot of the formularies on One Exchange have not been updated. So putting your drugs in comes back with, some of them, it says are covered and some aren't.
Okay, so that's good information for our viewers to know. The formularies, according to this gentleman, on One Exchange have not been updated. I believe they have been on Medicare.gov though, because we've run several clients through Medicare.gov and they appear to be current with the 2016 formularies. And that's another thing about drug plans. The formularies change every year. You know, maybe you got a drug that's covered pretty well this year and the same drug is not covered well next year. That's what's going on with these drug plans. Okay, so the game plan, I think we mentioned, we don't want to beat this horse to death here, but the game plan is to take out a drug plan through One Exchange, for, obtain your cost plan through local representation, so you have local service. You know, there's a form that has to be sent in if you buy a pair of eyeglasses to get that $125 allowance. Some providers will send it in automatically to Blue Cross, but a lot of them won't. We have those forms at our office. So people run by our office, pick up one of those forms, or we'll fax it in for them. You know, that's local service. We have a special person at the home office that we work with on claim problems, assigned to us. So we're not, you don't have to sit on an 800 number for an hour waiting to talk to somebody. You call us, we'll go to work for you on helping get a claim resolved. That's local service. Okay, that's enough of that. Dental plans, a lot of times during the open election period, people ask us about dental plans. And I guess our take on it is, we don't really have a preference. We leave that up to you. You can talk to the One Exchange advisor about the dental plans. There's 4 dental plans available. Do we have it on our screen here, Mitch? Next one. A lot of times, you're paying a premium and you're getting maybe 2 cleans a year, but if you have something major, like a crown or dentures, or an implant, your coverage, I've looked these plans over, they're pretty restrictive. Mostly you're getting 50% coverage up to a maximum of a certain dollar amount, like $1,000. Well, a crown, you know, could cost $1,200, and you're gonna get, best case, $600 reimbursed. And that's if you use a network provider. If you use a non-network provider, the company, dental company will knock that $1,200 down. They'll say, that's not usual and customary for this area, we're only gonna pay $1,000. So then you get $500 for a $1,200 crown. And yet you're paying pretty good premiums. I guess we've analyzed this thing, and I guess our take on it is, if you know for a fact that you're gonna have a crown next year, buy a dental plan. You know, or that you're gonna be using, you're gonna have some problems, dental problems, then the dental plan is not a bad deal. But generally, you can self-insure and probably come out ahead. But talk to your one exchange advisor about those. Okay, what else? The vision, we already talked about that. If you're in a cost plan, why pay extra for vision? It's $168 a year. You already get your exam free through your cost plan and a $125 allowance for a pair of eyewear. But that's once again up to you. I guess if your glasses are that expensive, it might be a good buy. Okay.
We wanted, okay. Since I'm going to be leaving, I'm just going to take over this meeting, okay? Anyway, we're at an hour, and I think research indicates that an hour and a half is kind of the limit for folks. So we're just about done. We just had a reimbursement tip. There it is, right there. Thank you. Mitch is always one step ahead of me. HRA reimbursement tip. If you haven't caught on to this thing yet, we brought sheets with us also. Feel free to avail yourself of those. There's some over on that table towards the kitchen and some towards the elevator over there. On submitting your Medicare Part B premiums that are automatically taken out of your, typically out of your Social Security. If you're drawing Social Security, the government will take your Medicare premium right out of there. And it was kind of amazing as we've been meeting with people over the past few years. Some people were unaware that that was happening. Saying, I get this much for Social Security. Well, yes, you do. Except, did you know about this roughly $105 that's coming out? What? So anyway, you're going to get a statement towards the end of November or early December. And by copying that statement that you get, it comes in a tri-folded envelope. You have to tear the edges off. Sometimes you end up ripping the sheet in half, trying to open it. And that tells you what your Medicare Part B premium is for the upcoming year. You can attach that to the reimbursement form. We can also help you with this. Send it in, and magically you get reimbursement money back. There is an issue for those of you who retired prior to 1996. There's an issue with this SHAP reimbursement. We're not going to cover that in detail right here. It's too time consuming. But you need to be careful how you submit for the Medicare Part B, because you can't double dip between SHAP and Medicare and one exchange. Okay, so I think we've pretty much indicated what we feel we bring to the table in terms of value. There's absolutely no cost to you for the work that we do. I've had people offer to pay me a fee. I say, well, you know, we just really don't work that way. We'd like to be your insurance representative. You buy your policy from us, and we get compensated. And we're making a living. So that's our philosophy on the thing, and we appreciate working with you. We meant to have questions at the end. We've got 2 microphones, and so we're at the, unless I missed anything, we're at the question area now. So here's another microphone. Question, yes.
Do you need to send a reimbursement form in for your insurance premiums, the Blue Cross and the dental or whatever else you're taking?
The question was, do you need to send a reimbursement form in for premium reimbursement? The answer is yes, along with proof that you paid your premium. And we're able to provide that proof for you. Okay, the question is, if you're paying your premiums automatically out of your checking account, that's money that's going to your insurance company, Blue Cross or Humana or whatever. And frankly, the insurance company could care less about Primetime Health or One Exchange. They just want their money, okay? So you have to take that additional step of proving that you paid that premium. Okay? So One Exchange has to know that you paid your premium or they won't release your money. One Exchange does not see that unless they are your agent. So for example, if One Exchange is your drug plan agent, it's a high likelihood that you will be automatically reimbursed. However, we have seen exceptions to that where you didn't get reimbursement. But if the drug plan, for example, the vast majority of our clients are on the Humana Walmart drug plan, very inexpensive plan. Doesn't amount to that much for the year. So you can actually gather your money faster and more effectively by submitting your Part B premium, because that's $105 a month, $1,250 a year. Well, yes, we'll talk. We'll talk one-on-one. Others.
There was a question that was submitted, and I just want to make sure that you captured that.
Okay.
The question was, are there any Obamacare changes affecting Medicare folks? And I think Mike covered it, but I just wanted to make sure that that gets covered.
Well, I think actually we did not cover that. The question was Obamacare changes affecting Medicare. Obamacare is basically the non-Medicare area. However, there were some aspects of that law that does affect Medicare beneficiaries, particularly in the drug arena, where the donut hole is closing very, very slowly. Year by year, it's closing. It's getting tighter where you don't have to pay as high a percentage. I don't have those percentages on me. 58% now this year on generic drugs. Actually, the brand name drugs stayed the same from 2015 to 2016. 45%. If you go into the donut hole, and I really don't want to get into a long, drawn-out conversation about that, but in its simplest sense, it's the amount of drug cost that you pay and that your insurance company pays. And for 2016, $3,300. If that exceeds $3,300, you enter this mysterious thing called the donut hole. And then if you're on a brand name drug, you have to pay 45% of it, and your drug plan pays 55%. And on a generic drug, you have to pay 58%, and the drug plan pays 42%. Those numbers are coming down rather slowly and will presumably eventually be zero. There will be no donut hole. What was the year on that?
Can I clarify that?
Yeah, please do, please do. Yes.
Okay, the initial coverage period under drug plans is 80-20. The companies have to pay at least 80% of the cost of the drugs. They can pay 100%, which they do in some cases if your copay is zero. In 2020, it'll be 80-20 from there on out. So you'll still have to pay 20% if you go into the gap, but it'll be 80-20 all the way through. That's my understanding.
Okay.
Where will the gap start today?
There will be no gap. You'll just pay 80-20 all the way through. The company will pay 80, you'll pay 20 all the way through. In 2020. That's one of the benefits, maybe the only benefit of Obamacare.
Mike said that, okay.
Okay.
Other questions?
We've got another question here. My future healthcare account is going to run out of money before I become Medicare eligible. What is my best option? And I rarely need medical care. Should I be switching to something different? And I think this is a Mitch question potentially here. how many actually know what happens to your future health care account, for those that are at future health care account? Know what happens when you become Medicare eligible?
Dave Ness.
Dave knows.
It gets converted to a health reimbursement account that then is managed by One Exchange. Okay, so if you drain your future health care account, that is the subsidy that IBM will be giving you, managed through future health care, or whatever. And once you run out of future health care accounts, that's it. There's no more subsidy from IBM.
Right, so the question as to what you can do to preserve or prolong your future health account is what I spoke about earlier, where if you can manage your modified adjusted gross income on your taxes, you may be able to retain that future health account money, save it, and perhaps get a subsidized premium on the MidSure marketplace. If you don't qualify for a subsidized premium, we don't know what the rates are going to be for the IBM plan for 2016, but assuming that they would be lower than the marketplace rates, my advice would be that you continue to use your future health account and spend it down now rather than saving it. It'll never be worth more than it is today in today's money. So, and as you've seen, the rates and out-of-pocket expenses once you're Medicare eligible are much lower than when you're not Medicare eligible. So using that money now would generally be our best advice, my best advice.
Mitch, would you go through, when that money runs out, what should they do? I've heard some people say, well, I'll just keep a penny or a dollar in One Exchange so I can always use One Exchange.
Right,
Answer that.
thanks, Colleen. Once your money runs out, your FHA money runs out, then you will not be required to do business with One Exchange at all. You can go in the Medicare marketplace, work with us or an agent.
Come with us.
Believe us, if you will, we're not trying to confuse you, but it just seems that way. But we were trying to also cover the non-Medicare area. So anything that we're saying about running out of money or stuff like that, we're talking to people who are not in Medicare yet. Okay, that might kind of a handful of people in here, I think. So I've had many Medicare eligible people who are getting their HRA subsidy from One Exchange ask me, are they gonna still give me my money next year? And I mean, I'm not in the inner circle at IBM. I don't know if they're going to or not, but I'll tell you what, with all the chaos they created 2 years ago, I can't imagine that they would want to duplicate that whole thing again. And, certainly IBM has put on their books into the future, this guy that retired this year, it's $3,000 for him and it's $3,500 for this guy, and that's sitting there on their books. And I would believe that they would have calculated that whole thing. So I believe you're gonna have your money. So when we say your fund running out of money, we are not talking about you if you are already on an HRA with One Exchange. Okay, I want to make that as clear as I possibly can. Yes, ma'am.
Do you have a contact email or something to find time?
Absolutely. We were deficient on that with the slideshow. We have cards on the tables. We have pens that have our
Right here.
Generations of Today. We have an advertising piece that has beautiful pictures of all our good-looking ladies and the rest of us guys. And yeah, we've got all kinds of sources here that we'd be happy to have you pick up. We missed that on the slideshow. I thank you for pointing that out. Yep, and we are there. Thank you so much. Yes. Anyone else?
I've got one more question.
Okay. Yes, sir.
If you're getting prescription drugs through Humana in Rochester, is the cost the same regardless of where you get them?
That is an excellent question, which I will repeat. If you are on the Humana drug plan, and the vast majority of people,
3 plans, which one?
there are 3 plans. Are you paying right now $15.70 a month for your plan? Humana Walmart drug plan?
What drug?
No, I'm sorry. The drug plan that you are on with Humana, if you are on the Humana Walmart drug plan, you don't want to go to any retail pharmacy other than Walmart. That's why it's called the Humana Walmart drug plan, or Sam's Club, which is Sam Walton of Walmart. Okay, so that's it. Now, they have 2 other drug plans, which have a broader network of, they have one called the Enhanced, and they have another one called the Preferred Drug Plan. Both of those drug plans are more expensive. They do have a broader list of pharmacies that are preferred pharmacies, but not the Humana Walmart plan. I'm sorry, yes, you're on a Blue Cross drug plan. I just had a comment that I'm paying $32 a month. That's a Blue Cross drug plan. Yes, Nancy? Okay.
The question was, can I buy my drugs anywhere? Depending upon the plan you have, you do have to know what pharmacies you should go to.
The comment was that you have to be very careful about what pharmacy you go to. This is something that we coach people with when we understand what drug plan they are in. And those of you who've lived in this area a long time and like to use Weber and Judd, I'm sorry, that's a local pharmacy. It's typically not a preferred pharmacy. It's rare. There are a few plans where it's a preferred pharmacy.
I've got one that was submitted online. I'm with Aetna Insurance Company by IBM Retiree Program. This was my last year with Aetna. I would like to sign up with Aetna again by One Exchange. Is Aetna available on One Exchange?
No. The Aetna PPO plan is over, and December 31st, 2015. So you need to get involved with One Exchange, get your HRA set up and everything, and if that is sounding like I'm speaking Greek, we would be happy to talk with you and help you through that process also. Yes, sir.
But there is a Aetna drug plan available.
There is an Aetna drug plan available, and it's looking pretty good for this year. I've already recommended it to 4 or 5, maybe a half dozen people. So again, it all depends on what your drug mix is. Anything else? Okay. I think we're going to close out. Thank you for coming.
You guys already clapped for primetime guys here, but I hope you all understand it's important. You don't have to go to primetime. But I strongly encourage you to go to somebody that you can talk to face to face. I recommend primetime. That's who I go to. But if you have somebody else that you work with, that's fine. Please consider a cash donation, and thank you very much for coming today.